Representative Valderrama.
Here to the bill.
To the bill.
For years, our state has led the nation in protecting reproductive care by codifying the right to abortion and contraception in state law by covering gender-affirming care in the Oregon Health Plan. Here in Oregon, we believe that everyone deserves access to high-quality health care, and that includes abortion. We believe that everyone should have the freedom to make their own reproductive health care decisions, no matter who they are, where they live, or how much money they make. But as a woman of color, I can tell you that this proclaimed right, this foundational value that we have, is not yet fully implemented. And as lawmakers, we cannot be so short-sighted to only pass laws. We have an obligation to think long-term about how these laws then become weaved into the foundation of our daily practices so that Oregonians can live fuller lives. Simply stating that Oregonians have the right to abortion and gender-affirming care does not mean Oregonians have access to those services. And in fact, that is the case many Oregonians find themselves in today. And if these services are not truly accessible, we are not delivering on what Oregonians have asked us to give them time and time again: their freedom to choose, their access to life-saving care, the opportunity to live full and healthy lives, and the freedom to decide when and how to start a family. Significant barriers to the full spectrum of healthcare exist in our state for low-income Oregonians, those living outside the I-5 corridor, women, LGBTQ, SIA+ individuals, immigrants, people with disabilities, and Black and brown communities. Communities of color face higher rates of birth or mortality, with Black women having the highest rates of maternal mortality in the country. Black girls and women are more likely to experience contraceptive deserts, with 3/4 of Oregon counties not having an abortion provider. The disproportionate impact of this lack of access to care on Black and brown communities could not be more evident. Eastern Oregonians are experiencing a 35% decrease in access to sexual and reproductive health care right now. Without expanding support, some Oregonians will have to travel 350 miles in-state for often life-saving health care. What's more, nearly 3/4 of transgender Oregonians do not live near a provider who has openings within a month to receive services, translating to years-long wait lists for life-saving gender-affirming care. Can you imagine waiting for over a year for life-saving care while hundreds of books about who you are being banned? While hundreds of pieces of legislation are introduced across the country attempting to further limit your access to care? While violence against you is at an all-time high and you've done everything you can to access the care you need? In a testimony submitted by Basic Rights Oregon, it states, quote, "I've heard from trans women who face anti-trans harassment because of their appearances. I've heard from folks who have to choose between driving 2 hours to the nearest provider or making a much-needed shift at work that day. And I've heard from people whose overwhelming dysphoria, the mental distress we experience when our outward appearance doesn't align with our gender identity, keeps them from achieving their goals and existing fully in society. Consider finding childcare, taking time off work or school for either reproductive or gender-affirming care. Colleagues, I believe we are failing Oregonians, many of whom currently have to travel hundreds of miles to access this care. As politicians, I believe we're failing to deliver fundamental freedoms. We're failing to address racial inequities, even when we've stated we know they exist, and we're failing those who need us the most. And so to address these issues, Speaker Rayfield convened the Reproductive Health and Access to Care Work Group, where we worked with more than 80 stakeholders representing local community organizations, providers, national legal experts, patients, clinics, advocates to identify barriers for patients seeking care, the challenges healthcare providers and facilities face in delivering care, and the potential legal issues patients and providers may face. Through an extensive research process and a series of discussions nearly weekly over many months, the work group identified recommendations that were evaluated by legislators to form the bones of what is now the Reproductive Health and Access to Care bill before us today. HB 2002 declares an individual's decision rights regarding their reproductive health as fundamental right and options available when these rights are violated. It also directs student health centers operated by higher education institutions to provide reproductive health services and submit plans and reports. The bill restricts private and public benefit plans from denying or limiting coverage for gender-affirming treatment or issuing adverse benefit determinations with exceptions. A federal qualified health center expansion pilot project is established under this bill to provide grants to 2 health centers located in rural and medically underserved areas of the state. Colleagues, we also know what this bill will cost. There is a fiscal impact statement. The LFO budget report posted on OLIS estimates this fiscal impact for the 2023-2025 biennium is $4.5 million to the general fund and 3 positions, 2 FTE. That includes $2.3 million for the Rural Health Pilot Program, $1.6 million for the Student Health Center Reproductive Health Grant Program, and $566K for administrative costs. Now, some of you may be hearing about rare and hypothetical situations that are out of context as a distraction from the goals of this legislation. These scenarios are being used as a distraction because of the opponents' actual issues with these bills. Opposition to abortion access is out of step with Oregon values. This legislation ensures providers and patients have certainty around providing and accessing reproductive health care services in any scenario. And that's why we need HB 2002 to protect and clarify Oregon values and Oregon law. Colleagues, I come before you today in support of this bill, not only as someone whose life has been changed by the reproductive care I've accessed in my lifetime, but also as a mom. So many elders and ancestors of mine lived and died for the rights and health care access identified in this bill. So many of our communities survived forced sterilization practices and policies, medical experimentation, and criminalization. Some say these policies are long gone, but the fall of Roe and implementation of abortion bans in Texas and in other states have already led to rising morbidity and mortality of patients. Still today, Black and brown families are being torn apart disproportionately through our foster care system, deportations, and criminalization. We are not so far away, again, from being in a time when this lack of access can have fatal implications. Colleagues, Oregon's state motto is, "She flies with her own wings." How can we expect all Oregonians to fly if we've not provided them with the wings to do so? Rights that cannot be exercised are not rights. They are value statements. I'd like to thank the thousands of Oregonians who have engaged in this policy, especially our coalition partners, our work group members, constituents, agency staff, elected partners, and anyone else who may have been involved along the way. Because of you, I believe today we will pass the strongest and most comprehensive reproductive and gender-affirming care bill in the country. I'm honored to be the first chief sponsor of HB 2002, the Reproductive Health and Access to Care Bill. Here in Oregon, we stand as a national leader. We stand for reproductive health care and access to LGBTQ+ rights. We did not come all this way to go backwards. We did not come all this way to not keep flying, because here in Oregon, we fly with our own wings. I urge an aye vote on HB 2002.
Thank you, Representative, for the discussion.